Hello friends, warm welcome to our channel World of Zoology. Welcome back to our lecture series on common human diseases and disorders from paper 2 unit 3, and we're going to discuss new point from the topic, and which is nothing but hepatitis. First of all, what is hepatitis? Hepatitis is actually a condition where a particular individual refers a inflammatory condition of the liver, and it's most commonly caused by the viral infection. Sometimes it may be caused by the drugs, use of alcohol, or certain medical conditions. And we're going to discuss in detail about the hepatitis, its types, and each and every point. We'll first consider the definition of the hepatitis. Viral hepatitis is a systemic disease with primary inflammation of the liver by any one of the heterogeneous group of hepatotropic viruses. We're going to discuss each point one by one: introduction, types, causes, symptoms, diagnosis, then treatment and preventive measures or prophylaxis. Here the summary is given with the source of the virus, vitamin E, hepatitis A virus it occurs in the fecal matter. Then B, in the blood and blood derivatives of the body fluid. Hepatitis C virus is also found in the blood and blood derivatives of the body fluid. Hepatitis C virus, which is occur in the blood and blood derivatives of the body fluid. Again, hepatitis E virus, it occurs in the fecal matter. Then the route of transmission, that is feco-oral, through the fecal matter, and it contaminates the food or water. And hepatitis B virus, and its route of transmission is through percutaneous, permucosal. Same is the route of transmission for hepatitis C and D virus, and for E, the route of transmission is again same as like that of the hepatitis A virus. That is feco-oral, that is the virus are present in the fecal matter and they contaminate drinking water or the food. The chronic infection, which is caused by the three types of the hepatitis virus, that is B, C, and D. As compared to that, A and A and E, they are not chronic infectious. Now, regarding the prevention, pre and post exposure immunization, which is possible in case of the A, and where we ensure the safe drinking water or safe food not contaminated by the fecal matter, or the handlers, they must be safe. Then pre and post exposure immunization, blood donor screening is observed for B, C, and D. Now regarding the introduction of our topic, that is hepatitis, the derivation of the term. The term hepatitis is derived from Greek term heper, meaning liver, and the suffix itis means inflammation, and therefore hepatitis refers to an inflammatory condition of the liver. It is medical condition which is defined by the inflammation of the liver and characterized by the presence of inflammatory cells in the tissue of the organ, that is hepatic cells. It is commonly caused by a viral infection, but there are other possible causes of hepatitis. These include autoimmune hepatitis and hepatitis that occurs as a secondary result of medications, drugs, toxins, and also by the use of the alcohol. Autoimmune hepatitis means a disease that occurs when your body makes antibody against your liver tissue. Means here our own liver is treated as foreign body and against which antibodies are produced by our immune system so as to destroy the hepatic cells. Now we'll consider the functions of the liver, because in case of autoimmune hepatitis, it may cause destruction or also by the infection which is caused in the previous condition by the A, B, C, D, E common hepatitis virus that damage the liver. And as you know that liver is vital organ as it performs many critical functions that affects metabolism throughout our body, and that includes bile production, which is essential to digestion. As you know that the bile is essential for emulsification of the fat, that is fatty type of food material cannot digest in absence of the proper functioning of the liver. Filtering of toxins from the body, that is detoxification, which is also one of the function of the liver. Excretion of the bilirubin, which is formed due to the destruction of the RBCs. Cholesterol, hormones, and drugs which are excreted by the liver, that is the function of the liver detoxification. Again, liver play important role in the breakdown of the carbohydrate, fats, and proteins. As you know that the glycoproteins, or the what we term as glycogen, is stored in the liver in the form of the glycogen. Glucose is stored in the liver, which is storehouse or the depot for the food material to stored in a small space of the liver. Also, the breakdown of fats and proteins, for which the role of liver is important. Activation of the enzymes, which are specialized proteins essential to body functions. That enzymes are activated due to liver. Storage of the glycogen, which is a form of sugar, and minerals. Also, the vitamins are stored in the liver. Fats, especially fat soluble vitamins A, D, E, K, are stored in the liver. Synthesis of the blood proteins such as albumin, which is also one of the function of the liver. Synthesis of the clotting factors, which are essential for the clotting of the blood, so as to avoid further loss during bleeding of the blood. Now we'll consider the next point, that is nothing but the types of hepatitis. There are 5 main hepatitis viruses referred to as A, B, C, D, and E hepatitis virus. These 5 types of viruses are of great concern because of the burden of illness and the death they cause, and potential for outbreaks and epidemic spread. We'll consider each virus one by one, as a hepatitis A virus, which is abbreviated as HAV, hepatitis B virus as HBV, hepatitis C virus as HCV, hepatitis D virus as HDV, hepatitis E virus as HEV. We'll first consider hepatitis A virus, which is shown here in this slide. Hepatitis A virus is a naked RNA virus related to enteroviruses, formerly known as enterovirus 72. Now all these viruses are put into its own family, Heptoviridae. One stable stereotype is there, and which is shown in this slide. Now we'll consider the next point, that is symptoms of hepatitis A. We'll discuss one by one. Yellowness of the eye, which is the main symptom of the jaundice. Reduction in the appetite. Then weakness, which is observed in the patient, or the fatigue condition. Pains in the joints. Digestive disorders, it may lead to diarrhea, vomiting. Then pains in the on the right side of the abdomen, because the right side shows the paining in the which is one of the symptom of the hepatitis. Nausea and vomiting. Also the next symptom, that is darkness of the urine, and we must remember the color of the urine, which is orange yellow. Usually we can observe the pale yellow urine, but during hepatitis infection the color changes to orange yellow, and the color of the stool will be pale color or paler, it becomes paler. Also the flu-like symptoms, that is feverishness, fever is observed, which is one of the symptom of the hepatitis A virus. Thus hepatitis A virus, which shows certain characteristics, certain symptoms which are different from the rest of the viruses. It is present in the fecal matter of the infected person and is most often transmitted through consumption of contaminated water or food. Certain sex practices can also spread hepatitis A virus. The time from the infection to the development of the symptom is around 30 days. What we term it as the particular period for the expression of the disease, that is 30 days, with a range of 15 to 49 days. Infections are in many cases mild or subtle, with most people making full recovery. After recovery, they remain immune from the further hepatitis A virus infection. However, hepatitis A infections can also be severe and life-threatening. Safe and effective vaccines are available to prevent hepatitis A virus infection. And now we'll consider the next virus, that is hepatitis B virus, which is shown here in this slide with its round shape within the liver, and then from the slide the enlarged part or the focus part is also shown here. Hepatitis B is transmitted through exposure to infective blood, semen, and other body fluids. Hepatitis B can be transmitted from infected mother to its infants at the time of birth, or from the family members to infant in early childhood. Transmission may also occur through infusions of the hepatitis B contaminated blood and blood product, which are contaminated. Also the contaminated injections during medical procedures, and injecting needles for drug use, through which there are chances of the hepatitis B infection. Here the hepatitis B infection that affect the liver is shown in this diagram with the liver cirrhosis, and also the yellowness of the eye is shown in this slide. The causes of hepatitis C infection are picturized in this slide with the structure of the hepatitis C virus, which is spherical and icosahedral in shape, is shown in this slide. Symptoms of the hepatitis C, which are shown here in this slide, that is yellowness of the skin and eyes, color of the urine, which is orange yellow, then light color stool, nausea and vomiting, loss of appetite, extreme fatigue or weakness, which is observed in these patients. Near about 70 to 80% of the people with hepatitis C don't show any symptom, and symptoms observed after the liver functioning that collapse or the disorder is observed in the liver functioning, and therefore liver damage is shown in this diagram with acute infection. Nearly 20% patient they can cure, and 80% shows chronic inflammation of the liver that leads to fibrosis and cirrhosis of the liver in near about 15 to 20% of the patient, and out of which 1 to 2%, near about 1 to 4% per year patient shows cancer of the liver. Now we'll consider the next, that is hepatitis C virus, which is mostly transmitted through exposure to the infective blood. This may happen through transfusion of the HCV contaminated blood and blood products, contaminated injections during medical procedures, and through injection drugs used. Sexual transmission is also possible, but is much less common, and there is no vaccine which is available for the um, hepatitis C. Now we'll consider the hepatitis D virus, which is shown here, usually occurs as a result of parenteral contact with the infected body fluids. Common mode of transmission for these viruses include receipt of the contaminated blood, or when blood products are received by a particular person, invasive medical procedures during contaminated by using contaminated equipments during treatment. For the hepatitis B, transmission from mother to baby at birth, from family members to child, and may also by the sexual contact. But we'll have to remember that the development of hepatitis G virus is not possible in absence of hepatitis B virus. Hepatitis E virus here is shown, and its endemicity is shown in this slide, where India shows highly endemism as far as the hepatitis E virus is concerned, which is waterborne outbreak, and shown here with the specific color. Then endemic countries are also shown with orange shade, brown shade represent highly endemism, and orange shade represent endemic countries, and non-endemic countries are shown by the light color. Here the structure of the shape of the hepatitis E virus. Now causes of the hepatitis, non-infectious hepatitis actually: alcohol and other toxins. Excessive alcohol consumption can cause liver damage and inflammation of the liver. This is sometimes referred to as alcoholic hepatitis. The alcohol directly injures hepatic cells. Over time, it can cause permanent damage and lead to liver failure and cirrhosis. A thickening and scarring of the liver. Other toxic causes of the hepatitis include overuse or overdose of the medications and exposure to poisons or toxic substances. Now the next point, that is autoimmune system response, which is explained by me in the previous part of this lecture. In most cases, the immune system mistakes the liver as a harmful object or as a foreign body and begin to attack it. It causes ongoing inflammation that can range from mild to severe, often hindering liver function. It's 3 times more common in case of the females than male. Here, the body's own cells are destroyed, that is, hepatic cells are destroyed by the immunity of that particular patient. Now, we'll consider the next point, that is symptoms. If you have infectious forms of the hepatitis that are chronic, like hepatitis B or C, you may not have symptoms in the beginning. Symptoms may not occur until damage affect the liver function. Signs and symptoms of acute hepatitis appear quickly, and these signs and symptoms of the acute hepatitis include fatigue or the weakness, which is observed in the patient, then flu-like symptoms, color of the urine, which is darker one or orange yellow, pale color stool, abdominal pains on the especially on the right side, loss of appetite, unexplained weight loss of the patient, yellow skin and eyes, which may be signs of the jaundice. Chronic hepatitis develops slowly, so these signs and symptoms may be too subtle or to notice. Now we'll consider the next point, that is nothing but the diagnosis with the help of the history and physical examination. First of all, to diagnose hepatitis, first your doctor will take your history to determine any risk factor you may have for the infectious or non-infectious hepatitis. During physical examination, your doctor may press down gently to your abdomen to see if there is pain or tenderness which is observed. Your doctor may also feel to see if your liver is enlarged. If your skin and eyes are yellow, your doctor will note these all things during the physical examination. Liver function test is the next diagnostic test, to use blood samples to determine how efficient your liver was. Abnormal result of this test may be the first indication that there is problem, especially if you don't show any sign or physical examination of the liver disease. The high liver enzyme levels may indicate that your liver is stressed, damaged, or not functioning properly. For abnormal liver function, blood tests can check for the viruses that cause hepatitis. They can also be used to check the antibodies that are common in conditions like autoimmune hepatitis. In some cases, abdominal ultrasound, which is used ultrasound waves to create an image of the organ within your abdomen. It can reveal the presence of fluid in the abdomen, that is in the coelomic cavity, liver damage or enlargement of the liver tumors, abnormalities of the gallbladder can be observed during ultrasound. Next test is a liver biopsy test that allows your doctor to determine how infection or inflammation has affected your liver. It can also be used to sample any area in your liver that appears abnormal. That means from the abnormal area, sample is collected of the hepatic cell for the examination or for biopsy purpose. Treatment options are determined by which type of hepatitis patient have, or whether the infection is acute or whether it is chronic. Hepatitis A usually doesn't require treatment because it is short-term illness. Bed rest may be recommended if symptoms cause a great deal of discomfort. If you experience vomiting or diarrhea, follow your doctor's order for hydration and nutrition. Also, a particular food material which is easy to digest can be used by the patient. Acute hepatitis B doesn't require specific treatment. Chronic hepatitis B is treated with antiviral medications. This form of treatment can be costly. It must be continued for several months or years. Treatment for chronic hepatitis B also requires regular medical evaluations and monitoring to determine if the virus is responding to that particular treatment. Antiviral medications are used to treat both acute and chronic form of the hepatitis C, that is next form. People who develop chronic hepatitis C are typically treated with combination of antiviral drug therapies. They may also need further testing to determine the best form of the treatment. People who develop cirrhosis, that is scarring of the liver or liver disease as a result of chronic hepatitis C, may be uh, candidates for the liver transplant. No antiviral medications exist for the treatment of the hepatitis D at this time. According to 2013 study trusted source, a drug called alpha interferon can be used to treat hepatitis D. Currently, no specific medical therapies are available to treat hepatitis E because the infection is often acute. It typically resolves on its own. That is the power of our immunity. People with this type of infection are often advised to get adequate rest, drink plenty of fluids or water, get enough nutrient, and avoid alcohol. However, pregnant women who develop this type of infection require close monitoring and care. That must be remembered. Here in this slide, the summary of all 5 types of hepatitis infection is given with its name of the virus, that is hepatitis A, B, C, D or E. Classification of the type of the virus, which is also given for, say for example, hepatitis D virus, that is delta virus. Hepatitis A virus, that is picorna virus, with its viral genome, that is ssRNA, DNA, ssRNA. Remember that all the viruses are RNA. They contain the genetic material in the form of the RNA. Except only hepatitis B virus, that it contains dsDNA. Then mode of transmission: enteric, parental, and then lastly in the hepatitis E virus, it is enteric. Through contaminated food and water. The conditions are same for hepatitis A and hepatitis E virus. Then incubation period. The incubation period means the period between the entry of the parasite or virus into the body of the host up to the first appearance of the symptoms of the particular disease, which is termed as the incubation period of the particular disease. Here for hepatitis A infection, the incubation period is 5 to 45 days. For hepatitis B, it is 45 to 160 days. For hepatitis C infection, the incubation period is 15 to 150 days. For hepatitis D infection, the incubation period is 30 to 60 days. And for hepatitis E virus, the incubation period is 15 to 60 days. Remember that incubation period means the first entry of that particular parasite. That is a period of, or the interval between the entry of the parasite within the body of the host and the appearance of the first symptoms of that particular disease. That period is known as incubation period. Now the chronic hepatitis, which is caused by all these viruses, no chronic hepatitis observed in the hepatitis A virus or by the hepatitis E virus, and with hepatitis B, C and D, yes, it is chronic, and 10% chances, 50% chances in case of hepatitis C, hepatitis D, 5% of the co-infections and 80% of the super-infectious conditions are observed. Whether it is possible to cure that particular infection in case of hepatitis A, no cure, treatment usually tackle the symptoms. In case of hepatitis B, no cure, treatment usually tackle the symptoms. Same is the condition for the hepatitis C. Hepatitis D, no cure, treatment alpha interferon for 12 months, which is required for longer period. For hepatitis E, no cure, treatment usually tackles the symptoms. Now we can conclude the viral infection for the hepatitis. A different virus is responsible for each type of virally transmitted hepatitis. That means it may be hepatitis which is caused by hepatitis A, B, C, D or E virus. Hepatitis A is usually an acute short-term disease, while hepatitis B, C and D are most likely to become ongoing and chronic one. Hepatitis E again is usually acute, but the serious condition may arise in case of the pregnant woman. It is dangerous. Now the preventive measures or the prophylaxis. Practicing good hygiene is one key way to avoid hepatitis A and E, as like that of the COVID situation, which is also COVID-19 is a virus, and so as to get rid of that virus, we can wash our hands frequently or sanitize the hands. If you are traveling to the developing country, you should avoid local water or the ice. The source of water for the preparation of ice is unknown, therefore you should avoid local water, ice, raw and undercooked shellfish and oysters, or the raw fruits and vegetables should be avoided. Hepatitis B, C and D contracted through contaminated blood and can be prevented by not sharing the drug needles by the drug addicts, not sharing razors, not using someone else's toothbrush, not touching spilled blood on the surface. Thank you for watching this video. Share this video for the benefit of the maximum students and subscribe the channel World of Zoology for the notification of my further video on the same topic. Thank you.